Hi students, good morning and let's come to the next video in oral pathology. I'm Dr. Gopi Krishnan discussing oral pathology with you. Okay, so we are dealing with odontogenic tumors now. Okay, so we have seen various odontogenic tumors, and in this video we will discuss about AOT, adenomatoid odontogenic tumor. Okay, so this is very simple tumor, AOT, adenomatoid odontogenic tumor. What you have to learn in AOT is that AOT has a very interesting histological appearance. Okay, so AOT is a particular in its histological appearance, and it is very interesting also. Okay, so this is a very favorite question, mostly image based question. Okay, there are so many questions they have asked from this single tumor AOT. Okay, and it is very simple. You have to understand, you have to learn 2-3 names in this which is related to AOT. Okay, so let's come to certain facts about AOT, or adenomatoid odontogenic tumor. You may have heard this favorite question from your external while having your viva. It's like, what is two-third tumor, right? Tumor of two-third. Okay, two-third tumor. That is your AOT. Actually, AOT, two-third cases they occur in the maxilla. So the most common site for AOT. Okay, the most common site for AOT is your anterior maxilla. So two-third of the cases they comes in the anterior maxilla. Okay, anterior maxilla is a favorite site, and two-third cases they comes in females. Okay, females. So females are more prone to have AOT. So these are certain interesting features you should know. Two-third of the cases they come in along with the impacted tooth. Okay, impacted tooth relation will be there, and two-third cases they come in young age. Okay, young age. So so many cases they comes in young ages. So this is why it is called a tumor of two-third cases in the anterior maxilla, and most commonly in young females along with the impacted tooth. Okay, and see, AOT is a very simple tumor, and mostly it comes 2 to 7% of your odontogenic tumors consist of your AOT. Okay, and it is considered, AOT is considered a hamartoma. Now, what do you mean by hamartoma? Okay, what is the term hamartoma? See, hamartomas are tumors or tumor-like lesions that comes from a cell which is native to that area. Means the odontogenic epithelium. What is the native place of your odontogenic epithelium? Your jaw, right? Your alveolus, your jaw, where it is supposed to be. Okay, that is their native place. Okay, so if there is a small growth, we say a small, all that growth is not hamartoma. Hamartomas are usually small growth, okay, of cells which are native to that area. Okay, so AOT will not grow much in size. Usually it is less than 3 centimeters. Usually it comes less than 3 centimeters, and it will not show any much features of your malignancy or much features of a tumor. It is a small growth. So, and it is native to that area. So AOT arises from, AOT arises from your dental lamina. A dental lamina or its remnants. Okay, or its remnants. Dental lamina or its remnants, your tooth apparatus, it arises. Okay, so it usually is small in size and it is on the jaw. So it is considered a hamartoma. Okay, it is considered a hamartoma. So an odontogenic tumor which is considered a hamartoma is AOT. But there is one more odontogenic tumor which is considered a hamartoma is your odontoma. Okay, odontoma is also considered as a hamartoma. So AOT and odontomas are odontogenic tumors which are considered to be hamartoma. So what is the opposite of this hamartoma? Means a small growth which is from a cell that is non-native to that area. So we have seen it when we were discussing about developmental anomalies. If you remember, just give an exercise to your brain. There was a lesion, or there was a growth which is from a cell that is not native to that area. Okay, are you remembering Fordyce's granules? I think, hope you remember Fordyce's granules. Okay, if you are not remembering, if you are not seen this, please go to the video and see of developmental anomalies. So Fordyce's granules are sebaceous glands. Okay, sebaceous glands in the oral mucosa. Okay, oral mucosa. So you know that sebaceous glands are seen on the skin. It is not seen on the oral mucosa. Okay, so if there is an occurrence of the sebaceous glands, okay, in a non-native area, and oral mucosa is non-native area for them. Okay, so Fordyce's granules are an example of choriostoma. Choriostoma means the growth of a small growth of cells in an area which is non-native to them. Okay, so AOT is a hamartoma. AOT and odontoma is considered a hamartoma. Okay, so that is about their features. And AOT can arise from a dental follicle. Okay, in a dental follicle which is covering the crown of tooth. Okay, along with the crown of tooth, it can arise in a dental follicle, covering the crown of tooth. So it is called coronal. It is called a coronal type, or we say follicular type. So AOT can arise from the dental follicle, okay, in and around the dental follicle. If it is in and around the dental follicle, we call it coronal type or follicular type. 70% of the cases you have coronal type or a follicular type, okay, around the crown of the tooth. But few cases they comes near the roots of the tooth. Okay, so 30% of the cases they comes outside the follicle, that is extrafollicular, or we say extracoronal, and that comes in the root of the erupted tooth, near the roots of erupted tooth. Okay, these are two occurrence of your AOT. So AOT can either come in a dental follicle, mainly a dental follicle of an impacted tooth. Okay, of an impacted. To come in the crown of an impacted crown of a tooth, it should be impacted, right? It should be within the jaw. In an impacted tooth, it can come along with the dental follicle, or even after the tooth is erupted. AOT can come in the roots. Okay, near the roots. That is called extrafollicular or extracoronal. 30% cases of AOT is extra. Okay, so this is about certain facts in AOT. Now, I'll show you an image. Okay, can you see this radiograph? There is two radiographs here. Okay, so there is two radiographs here. You can see this is AOT which is coming along with the impacted tooth. So it is covering that crown and the root, and the impacted tooth is within the radiolucency. Okay, and you can see this is a radiolucency which is near to the roots of a erupted tooth. It is along the sides of a erupted tooth. Okay, so that is which part? That is extracoronal. This is a coronal variant, and this is an extracoronal variant. Okay, so this is about the occurrence of AOT. Now, what's the important point in AOT is its histology. Histopath of AOT is the most important thing and the question area in your NEET INICET papers. Okay, now AOT has a very interesting histological feature. It has certain interesting findings. First thing you see in AOT are cell-rich nodules. Okay, cell-rich nodules. So you see lot of nodules with the rich in cells. Okay, many small cells which make nodules. Okay, which make nodules. Okay, it will look like a nodule. Okay, that is these small cells should be spindle. It should become sometimes spindle or sometimes polygonal. Okay, sometimes spindle, sometimes polygonal cell which make up a nodule. Okay, it is rich in nodules. Those nodules are called cell-rich nodules. Okay, now what else they can see is that adenomatoid odontogenic tumor is the name. Adenomatoid. So adeno is something related to a gland, right? Adenoma. So you can imagine that, okay, some kind of adeno structures are there. What is related to a gland? Ducts are related to gland. So here also you can see some kind of duct-like structures. Okay, you have duct-like structures. Duct-like structures means you have a duct-like structures like this, and they are lined by columnar cells. Okay, lined by columnar cells. Duct-like structures lined by columnar cells, and they are called microcyst. Small spaces. Okay, small spaces. Very small cystic spaces. They are called duct-like structures or microcystic spaces. And inside this microcystic spaces, you can see a deposition of a red pink material. A pink material is deposited like a ring in this. that is called hyaline ring. Hyaline ring. Okay, hyaline ring is seen. Okay, sometimes you can see these microcystic spaces. Sometimes the microcystic spaces contain a drop, or a pink drop inside this. It is called a tumor drop, tumor droplet, or we say hyaline droplet, a hyaline droplet. Okay, so see, we will see all this in this picture. Can you see this? Okay, this is the histology of AOT. Very, very important IBQ, image based question, and it is very easy to identify if you know the theory. Right? Can you see this is one nodule, the second nodule, the third nodule, fourth nodule here. So it is like fifth nodule here. Okay, so can you see this cells? These cells are arranged in small nodules, right? Small balls, right? It is looking like ball of cells, right? These ball of cells are called cell rich nodules. Okay, cell rich nodules. And same time you can see this empty area. Okay, I will draw with a different color here. Okay, can you see this area? Okay, see, that is a microcyst. Okay, it is a microcyst. It's a microcyst. It is having this columnar cell lining around it. You can easily appreciate that. I will zoom it for you. See, you can see that microcystic area with lined by columnar cells, right? So this is microcystic spaces, and inside this you can see some kind of pinkish material, just like a ring. It is called a hyaline ring. Okay, hyaline ring. Okay, this is the main histological feature of your AOT. Okay, so if you see cell rich nodules, if you see microcystic spaces, if you see hyaline ring or tumor droplets, okay, you can say that this is a AOT. But AOT has additional histological features which are rarely seen, and INICET has asked many questions in that. Okay, in the previous paper. Okay, that is not normally seen, but sometimes you can see in the AOT, and that is very particular to AOT. Okay, can you see this structure here? Okay, you can see this structure here. Okay, so you can see that the nucleus in this are arranged in a very flower like pattern, right? Flower like pattern, you can see that. That is called a tumor rosette. Okay, rosette. So the fifth one, I will fourth one I will write here. The fourth feature is having a tumor rosette. Rosette means a flower like or wreath like. Okay, rose, just like a flower. Rose or flower like arrangement. Okay, flower like arrangement, tumor rosette. Okay, it can be easily seen here. Can you see this image? This is a tumor rosette. Okay, which I have marked right now. Okay, this one, this is a tumor rosette. You can see that nucleus, how beautifully the nucleus are arranged in a flower like pattern. Okay, tumor rosettes can be seen. Then what next you can see? You see this picture, this one, the first picture here. Can you see this arrangement here? Okay, I will draw it again. See this arrangement. You have a nucleus arranged in lines in two rows. There is one row outside and one row inside. Okay, there's one row outside and one row inside. I will erase and show you more. Okay, this why I am insisting, because these are all image based questions, IBQs. You see the how beautiful the pattern is. Okay, and that pattern of arrangement with the one row of cells on inner side, one row of cell outside, that is a convoluted double row pattern, means two rows of cells, right? That is called a convoluted double row. This is a double row. Okay, double row pattern. I will show you. So we will write it here. What is the fifth point? Fifth point is a convoluted double row. Right here, convoluted double row pattern is seen. Okay, so this is one thing. Next one. Next is the most important part. Can you see this thing here? Okay, there is some kind of calcifications here. Calcifications. Okay, there are some kind of calcifications there. Okay, and this area where you can see some polygonal cells, these are all polygonal cells with the calcifications. These calcifications are called Lees-Gang rings. Lees-Gang rings. Now you may ask me, least gang rings are seen in CEOT or your pin box number. Why in AOT? Okay, so you may have learned that least gang rings are seen in CEOT. Okay, so in your UG, what you have studied that least gang rings are seen in COT, but there is one important thing. In AOT, you can see certain areas which look like CEOT. Okay, so in AOT, please remember, in AOT you can see certain areas with polygonal cells and this least gang ring just similar like a CEOT, and that areas are called CEOT like areas. Okay, so what is our sixth point? We have CEOT like areas. Okay, CEOT like areas. So in AOT you have CEOT like areas. Okay, so that is one thing. Then can you see? Okay, see, this is more clear. CEOT like areas, what you are seeing are the calcifications. You see these calcifications, they are nothing but your least gang rings. Okay, least gang rings. Okay, this is about your AOT. So what all the histological structures you see, just have a recap here. You are seeing cell rich nodules, small nodules of cells which are spindle or polygonal, that are called cell rich nodules. You are seeing duct like structures or microcystic structures covered or aligned by your columnar cells. In the center you see a pink ring or called hyaline ring. Okay, and if it is very small, if you're cutting that hyaline duct very close, you get a instead of a ring you get a pink drop. Okay, pink filled area, that is called a tumor droplet or hyaline droplet. And you see rosette arrangement, that is tumor rosettes. Then you see convoluted double row pattern, and you see CEOT like area. So just remember this 5 to 6 points, 5 to 6 histological names in AOT. Okay, so they have asked so many questions in this AOT, both what one word questions and both image based question, IBQ. So please go through AOT very well. If you get one or two questions from AOT, it will be very scoring one. Okay, so don't miss this. Okay, this is very important area. I hope you understood AOT very well. See you in the next video with the next topic.